I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and perimenopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. You're tuned to the Not Your Mother's Menopause podcast. I'm Dr. Fiona Lovely, and thanks for joining me today. I say, buckle up for this one. I'm really excited about this conversation. I'm sorry, I feel like I've said that to you so many times over the years. I'm so enthusiastic for anything that gives us the opportunity to have better health and through information and science. And today's conversation is no exception. Today's guest is Cathy Eason, and she is a certified holistic nutritionist and clinical educator. And she's here to talk to us about nitric oxide, or NO. Its medical application is vasodilation. What does that mean? It means blood flow. And without blood flow, babes, you got nothing. That's basically the easiest way I can explain it. Our circulatory system, which Cathy talks about at length, which sounds dead boring, I promise you it is not, is the way our bodies get nutrient, get gas exchange to the cells, have waste removal, have transmission of hormones throughout the system and nutrients, etc. So blood flow is an important aspect of living. That's the best way to say it. So, and nitric oxide, you might have heard of it. It's not just for boners. Okay, let me introduce my guest, and I'll share a little more about what she and I talked about. Cathy Eason is a board-certified holistic nutritionist with over 20 years of clinical experience. She specializes in digestive health, autoimmune conditions, neuroendocrine dysfunction, and metabolic imbalances with a strong focus on the clinical application of nutraceuticals. Cathy is passionate about supporting healthcare professionals through education, collaboration, and holistic strategies. Outside of work, she enjoys cooking, spending time in nature, and fostering wellness-focused communities. Yes! Cathy is one of those beautiful, wise women that if we sit at her feet, she has so much to teach us. And today I took a ton of notes and I learned a lot. And as I was saying, nitric oxide is not just for boners. It is for cardiovascular health for everybody. Because when you don't have enough nitric oxide, which declines by 50% in our 40s, we have less energy. Our sexual performance isn't very good. We have vasoconstriction, also inflammation, also elevated blood pressure, also elevated health risks when the circulation system isn't working the way it is. Now, nitric oxide is naturally on board. It's with us all the time. Cathy explains how and how it works in the body, where it gets stored, and how it gets recycled. I did not know this. So interesting. But how do you test it? And why should you test it? And why does it matter? It turns out that with a pilot study, which I talk about right off the top of the conversation, when you improve nitric oxide level for women, this is women's sexual function in particular, although it has vast ranging effects, but sexual function is a good way to start. 83% of women with optimized nitric oxide experienced improved orgasm and reduced pain. 75% had increased desire. 58% had increased lubrication. And as far as I'm concerned, that's good all the way around. We don't think about blood flow, but man, we should. And it's not just to the genitalia, it's to your brain. And this is very, very important conversation around heart health. cardiovascular health. And as you know, because you've listened to the show, that 1 in 2 of us will die from cardiovascular disease. So it's really important that we sort out our cardiovascular health. Turns out nitric oxide has function in the brain as well, on our neurotransmitters and our moods and our brain health. So important. We talk about supplements and efficiency of supplements. Oh, Kathy just shared so much. She also shared her journey as someone who's had healed herself from mold exposure disease, and where nitric oxide fits in that whole conversation. So I just can't wait for you to hear this. I think this information is so useful in so many ways. So without further ado, I hope you enjoy the conversation I had with Cathy Eason as much as I enjoyed being a part of it. Here she is. The AG1 you've all heard me talking about for so long just went through a major upgrade. AG1's next gen is here. It's the same single scoop once a day, but now it's clinically backed and formulated with more upgraded vitamins, minerals, and probiotics. The new next gen formula offers a more advanced, clinically backed formula that fills common nutrient gaps and supports gut health, all in the same easy once a day ritual. AG1 has been a game changer for my mornings. It sets the tone for my day, helps me feel my best, and like I'm taking care of my nutrient needs in one step. AG1's next gen includes 5 clinically studied probiotics and additional vitamins and minerals to support whole body health. Now clinically backed with an advanced formula, this is the perfect time to try AG1 if you haven't yet. I've been drinking AG1 daily for 6 years now, and I'm so happy to be partnering with them. Subscribe today and try the next gen of AG1. If you use my link, you'll also get a free bottle of AG D3K2, that's vitamin D3K2, an AG1 welcome kit, and 5 of the upgraded AG1 travel packs with your first order. So make sure to check out drinkag1.com. That's drinkag1.com/Fiona Lovely to get started with AG1's next gen and notice the benefits for yourself. That's drinkag1.com/Fiona Lovely. This is the Not Your Mother's Menopause podcast. I'm Dr. Fiona Lovely, and today I have a guest named Cathy Eason with me. She is a clinical educator for Berkeley Life and a certified holistic nutritionist, and she is here to school us on nitric oxide, the thing you never knew that you needed to know all about. Cathy, welcome to the show.
Thank you so much. It's my pleasure and excitement to be here. I'm looking forward to our conversation immensely.
As am I. As I was reading through these amazing studies and data sheets that your people sent over to me, there was one in particular I pulled out. And I thought, you know what? We need to start this conversation with women's female sexual health. And so if I may read, I'm sure you're familiar with the details. For the listeners, there is Berkeley Life has done a clinical pilot study revealing the impact of nitric oxide, which we're going to talk all about here, on female sexual health. It was a 60-day pilot study where women took 2 capsules of nitric oxide each day. And the statistical improvements go like this: 75% improved desire, 58% experienced increased lubrication, 83% experienced enhanced orgasm, and 83% experienced reduced discomfort. Boom.
Hallelujah.
Exactly.
Better sex for women.
Yes. Better sensation, better lubrication, less pain,
Yes.
better orgasm. Come
Yes.
on. The world needs more orgasms. So how does this happen? This is a nitric oxide thing. Fill us in.
Yeah. Well, how it happens is, first of all, the supplement, the Nitric Oxide Foundation, is actually a dietary nitrate supplement. So nitric oxide is a gas. Our body produces it naturally, but we can't supplement with a gas. It has a half-life of 2 to 3 milliseconds. But what we can supplement with are dietary nitrates, and the cofactors that help us take them in and utilize them for all the benefits that nitric oxide does. And as you just read off those statistics, I've read the raw data. It's true. We're so excited about it that we have a longer clinical trial with a larger population going on right now. We hope to have those results from a broader group of women published by the end of, I think, by early 2026. And we're so excited because, yes, we used to talk about nitric oxide and men's health, erectile dysfunction. Help your partner get it up with beetroot. It was kind of how we used to talk about it. Now we know that it's not just men that benefit from enhanced blood flow, enhanced oxygen delivery to those tissues. It's also women. And that I think beyond the 83% that have a better orgasm, whatever that means, we did use a very specific survey for that questionnaire and of those subjects. But what's more important is that desire is better. Women are aging and having a healthier sex life as they age and a more robust sex life. This is who we're meant to be on this planet, not just for reproduction, but for connectivity and for, generating healthy people that love to be in community with each other. And I think the most important one of those statistics to me is increased lubrication leads to less pain, more satisfying sex, less painful sex. It starts to become a more pleasurable opportunity. And don't all women deserve that in this day and age?
Oh my God, yes, absolutely. And this is a very common thing I hear in my clinical practice is women having vaginal dryness and or reduced sensation and or pain. And usually those things go together. Of course, we know them as the genitourinary syndrome of menopause or the GSM. And we're learning so much about that. And what I'm hearing, actually, before I say that, I want to just point out for the listeners, Kathy, I'm sure you're aware of this, but male genitalia, which of course we are talking about in the realm of nitric oxide, we haven't quite gone there yet, but we're going to go there, starts out as female genitalia. And so
Yes,
we have the same erectile tissue, whether we're talking about the clitoris or the penis. So, of
exactly.
course, it's going to have the same effect, even though, I mean, the joke is women are not little men. It's more like men are big women. But, anyways, I don't know if I'm allowed to say that. That felt controversial. Well, I guess we'll find out, won't we?
Right. No, it's
Oh,
true. Women need tissue engorgement to make sex even possible. So from just a simple reproductive standpoint, if you're trying to make a baby, you need the parts to fit and you need the engorgement for the receptivity. If you are just enjoying sex with a partner because, that's love and that's making you feel great, it's important for that too, because otherwise our relationships are challenged when that really important piece of human nature is not allowed to happen just freely and easily and with less pain. We talk about the dietary nitrates being sort of the miracle molecule. And here we're talking about, yeah, it's bringing sex and a healthy sex life back for aging individuals as well as, for individuals trying to create families. And so from we've talked about it in kind of the bro culture in men's health for a long time. Now we're finally getting to talk about it in women's
in
health
women's
too.
health.
It's so
Yeah.
exciting.
And it's long overdue and it's perfectly timed all at the same time. So the first time I remember hearing about nitric oxide being an important factor for health, it was in the context of, it was probably 20 years ago. It may have been around the time of Viagra, although I think Viagra is older than that because I think this is how these drugs work in some way. Is that correct?
Correct.
Yes.
Yes.
Okay.
Yes.
So what I remember hearing was that men who have cardiovascular disease tend to have difficulties maintaining an erection because of the vascularity narrowing, etc. But I think there's more to it. I mean, we're so nitric oxide fits in here somewhere. Yes?
Yeah, let's talk about sort of the history of nitric oxide. So,
Please.
studied in the 60s and 70s, pharmacologists studying it in the late 1990s won a Nobel Prize in medicine for its discovery as a vasodilator. It is a signaling molecule to relax smooth muscle tissue, open blood vessels to improve blood flow, which then increases total body circulation. It increases oxygen delivery to all the tissues in every cell of the body, and it increases the delivery of nutrition as well around the body so that tissues can grow and multiply and go through their natural senescence. And since that time, the science in nitric oxide has discovered so many more signaling mechanisms of it. So, in both men's and women's sexual health, we know that nitric oxide plays a role in signaling sex hormone utilization and production. Part of the reason why women have better lubrication is because it's signaling the appropriate amounts of hormone during that time. Estrogen helps us lubricate. Oxytocin helps us feel connected and together with our partner. And we call it the love hormone for that reason. In men, we know that testosterone signals nitric oxide to increase blood flow so that erection is possible. And we also know that nitric oxide signals healthy neurotransmitter function. So this is, starting to get into mood balance. It's pretty hard to feel up for sex when you are living in a state of anxiety and depression, right?
Mm-hmm.
So we know that nitric oxide is a potent mental health component for us too. And like you, I remember studying nitric oxide back in biochemistry 101 way, way, way many years ago, studying to be a nutritionist and thinking, well, isn't that great of this molecule? But now there are 50 other physiological mechanisms we could talk about, and a lot of them around women's health, just from this one molecule and what it does. So the fact that none of us know about it and the importance of maintaining it through diet, lifestyle, exercise, I think that's the education we really need to get out for women. You also mentioned, having that relationship of men and cardiovascular risk. And I think that's the biggest piece of education I want to get out to women is that we know during the perimenopause and menopausal transition, we're losing estrogen capacity, right? And as we lose estrogen capacity, we look at studies on nitric oxide production and function, and we see that women tend to start to make a significant decline in the capacity of their endothelial tissue to produce nitric oxide. And it goes hand in hand with the drop in estrogen. So as estrogen declines, we see nitric oxide decline, and now we know why. It has to do with the fact that endogenously in our body, we have enzymes that help us produce nitric oxide. Those enzymes are reliant upon activated estrogen hormone receptors, specifically estrogen receptor alpha. When those receptors are not activated, the enzyme doesn't get turned on, nitric oxide or NO does not get made, blood flow decreases, we start to see blood pressure go up, we start to see accumulation of plaques and platelets in the blood vessel, and this is directly equivalent to women's cardiovascular disease risk going up at this very transitional period of their life. So if I could have listeners leave with one piece of education today, the big one, besides better sex, is being heart health preventive and really driving home, not just, we'd love for everybody to understand that decline and to take Berkeley Life as a, quick stopgap preventive measure. But we also want you to know about all the other things you can do. And that's eating your leafy green vegetables and getting regular exercise and avoiding some of the toxic elements in our lifestyle that tend to degrade and deplete nitric oxide on its own. So um, I'll let you choose where we start to dive in further on all of that.
Goodness. Wow, there's so much. We need to have the cardiovascular conversation on a deeper level because that is the thing that kills more women than anything else. It's not breast cancer, it's not Alzheimer's, although those things have their place. It is absolutely cardiovascular disease. And history doesn't have medicine doesn't have a very good history in terms of recognizing a woman having cardiovascular disease until it is advanced because we present so differently. So this is what's popping in my head right now, so I just have to speak it. So did I hear you say that circulation and nitric oxide, blood flow and nitric oxide are bedmates? Are those
They are
important?
bedmates.
Please
Yes.
share. Please share more.
Absolutely. So we often don't think about our blood flow. It's just, a natural process going on all the time, and we don't really think about what it does for us. At a basic level, your blood flow is carrying red blood cells that carry oxygen, that deliver oxygen to all the body's tissues. And we need that to make the energy that our cells make to give us energy and to grow tissues and to improve function and let us walk down the street with a smile on our face and saying hello to everybody. We need oxygen for that. Obviously, we all think about that. But we have 60,000 miles of blood vessels in our body. We have 400 miles of blood vessels in our brain alone. And in order to provide nutrition from the food we eat, I am a nutritionist, so I'm always going to bring in the food factor, right? But in order to deliver that nutrition to all the body's tissues, we need adequate blood flow. Adequate blood flow keeps our blood pressure regulated as well too. And when you look at the statistics in North America, yes, heart disease is the number one killer of women in North America. And in that realm of heart disease, high blood pressure is a common symptom of cardiovascular disease. But there's some like 75% of the North American population that doesn't even know that their blood pressure is elevated. It usually takes an event, an angina attack, chest pain attack, women having a stroke, women having a heart attack, for them to understand that they've been walking around with with high blood pressure and limited knowledge of it. So we don't really think about it. The other things we don't think about, blood flow is necessary to carry hormones around our body. So all that chemical signaling happens. It's important to fueling the neurotransmitters that keep our brain balanced and keep us thinking, learning, fighting off fear and panic, and adapting to stressful responses in our days. Blood flow carries our immune system cells and anti-inflammatory responses to help us manage that inflammation and immune piece so that we stay healthy, don't develop a viral infection, don't develop a bacterial infection, bring all the right molecules, chemicals, and nutrients in to fight those challenges that they're happening every day, all day long. We just don't always think about it. So I think that the other thing blood flow does for us is one symptom I hear a lot from women, two symptoms I hear a lot. Low energy. I just don't have energy for the day's activities. That can be a sign of diminished blood flow. And I also hear, how many times do you hear your patient say, I just always have cold hands and feet?
Yep.
They're not getting circulation to those distal extremities. So, of course, you're going to have cold hands and feet when you can't get the circulation to those areas. And one thing that Berkeley Life did that I was really impressed by when I started using the product clinically several years ago is we have a gold standard double-blind placebo-controlled trial showing that 2 capsules of our dietary nitrate formula taken daily for 12 weeks brings blood pressure down 10% and improves total body circulation through something called flow-mediated dilation. That's a lab measuring. And so we see the impact when NO levels are sustainable, circulation is great, oxygen gets everywhere it needs to go, nutrients get where they need to go, hormones, neurotransmitters, thermal regulation is better. And again, with as you and I were talking before, there are so many signs and symptoms of what people consider normal aging, but there's signs and symptoms of low NO is what really they are. And we want to get people to understand that blood flow is where it's at. And just because you're aging doesn't mean that your arteries have to harden and thicken and constrict and reduce your flow. We can age healthfully. It's partly why nitric oxide is now also being called the longevity molecule. It used to be the miracle molecule for everything it did. Now in this age of science-driven research, it's the longevity molecule, and it's helping people live more vibrant, healthy lives longer.
That's amazing.
Keeping us out of the recliner. That's my goal. I don't staying
That's
out
a
of
good
that.
one. Don't break a hip. Keep me out of the recliner.
Yeah.
Yeah, I like that. So I have a couple of things that are just sort of coming to mind here. I have extensive training in functional neurology and functional medicine. And one of my favorite teachers who teaches both of those things will say when you're doing the patient exam, certainly ask them about circulation. Do they tend to have cold hands and cold feet? but also touch the end of their nose because that's a really good way to gauge whether or not they actually have the microcirculation that's necessary to push the nutrient out that far. And if they don't, you have to address that before anything else because whatever you're thinking about doing, you're not going to get the same response if the blood carrying the nutrient and the oxygen exchange and all of that, or the oxygens to be exchanged, etc., hormones, whatever, can't get to all the tissues. So what you're saying is that the nitric oxide will actually help drive that circulation and blood flow.
Absolutely. And the other thing it does is we talk about delivery of all these beautiful compounds that we need. It's also a waste removal system. So your blood flow is crucial to detoxifying your body and taking away metabolites of things that the body has broken down that we no longer need and get rid of. And so I think that's an important concept too, is that blood flow has to stay healthy, not just to regulate blood pressure, not just to keep the tip of your nose warm, not just to prevent you from having headaches and neuropathies. We see a lot of use of dietary nitrates for those two conditions, but it's also to help us with waste removal and recycling of nutrients, making us operate more efficiently, and also keeping us cleaner inside. We live in kind of an incredibly toxic world these days, and we have to work harder than we used to keep our body sort of flushed and fresh inside, I like to call it. And so blood flow is super important to that as well too.
Mm. So, I want to talk about the experience of taking the dietary nitric oxide, dietary nitrate, I think is what you said, right?
Yes,
Yes.
yes.
So, this would be my own personal experience of taking it. And this is when I first met nitric oxide and Berkeley Life in Las Vegas this past December for the Longevity Festival. And the way I was sort of told about it, you're in these expos and there's all this stuff going on, and everybody's got their thing that they're talking about. And so I stood there and did the little strip, and it showed there's like a test strip situation. You'll have to explain what that is to the listeners, but there's a test strip for before, and then you take the capsule, and then as it 10 or 15 minutes later, you test again. Isn't that's the number?
It's going to take a little longer than 10 or 15 minutes. It's going to take about 60 to 90 minutes. So
Oh,
yeah,
we
I
must
should
have
have,
come back. We must have
yeah,
come. Yes, that's
you
right.
probably came back. I wish I had a
Yes.
test strip here. I don't, but yeah, this dietary nitrate recycling process that our body has is one of the most amazing physiological mechanisms we have. To me, it's just perfect innate intelligence for the body to say, look, we can't store this forever, but we can recycle and reuse it. So let's talk how that happens. We eat dietary nitrates primarily in plant foods. We eat them in things like spinach, arugula, beets, beet greens, celery, rhubarb. There's small amounts in other foods too, like quality meats and eggs and things like that. But really, think your leafy green vegetables. As a nutritionist, I'm going to ask everybody to please think about chewing their leafy green foods a little bit more because chewing is really important to breaking down those nitrates that are in those foods. We chew the foods, we mix it with our saliva. Now we're bathing an oral microbial community of nitrate reducing bacteria that are in the mouth. We start to break down nitrates in the mouth. We break it down to the next smaller molecule called nitrite. Some of that gets immediately pulled into the bloodstream and goes into making nitric oxide in the moment. What we don't capture in the mouth, we swallow. Now, the digestive juices of our stomach and our pancreatic enzymes help us break down some more. We pull nitrate into our bloodstream and we start utilizing it. And it's a simple reductive process where we take nitrate, reduce it to nitrite, reduce it to NO. What we use in the moment in NO can be reoxidized into nitrite. So you're going to have about a 45-minute half-life of nitrite circulating in your bloodstream at any one time. Some of that gets oxidized back to nitrate. Now that half-life is about 8 hours, but we can't hang on to it. So if we're not eating a leafy green spinach salad every 8 hours, how are we going to keep recycling this? Well, what doesn't get used in the moment gets excreted through the kidneys. That's quite a bit, actually. It's about 60% of the dietary nitrates you take in. About 25% gets utilized for all the functions in the body, and the rest gets recycled back to the salivary glands. We
Really?
have specific
Wow.
little storage lockers in the acinar cells of the salivary glands that store nitrate for us. So now, all day long, as we salivate, nitrates are being excreted into the mouth. They are bathing those oral microbes that help us break it down. We're
Mhm.
recycling it, and the whole process starts again. So, what the test strips are showing you is you get a little pool of saliva. Those particular nitrate reducing microbes, they live in the back of the mouth. They live sort of towards the back on top of the tongue. You get a little pool of saliva, you dip the test strip in there, you pinch the ends together, and what we want to see is a bright pink color that suggests that your oral microbe community is breaking down nitrate to nitrite. We would like to see that pink strip on a test strip all day long, 24 hours a day. That's not likely for most of us because nitric oxide is itself an antioxidant and it's working all day long in your body to combat free radicals, to reduce inflammatory properties, things happening. And it's working as an antioxidant. We're using a lot of it. So most of us are going to wake up low. We test in the morning, you see yourself low, you take a 2 capsule dose, which has been clinically validated to give you the amount of dietary nitrates to bring your status, your NO production capacity up to baseline. You swallow the 2 capsules, you wait about 90 minutes. 90 minutes is long enough to let the stomach acid, the pancreatic enzymes. We also have bacteria in the gut that help us break down our nitrates. So anything that didn't get captured earlier in digestion is going to be worked on in the large intestine. We recycle some of it back. And if your test strip improves, now you know that you are being efficient at recycling those dietary nitrates. So what happens for the patient is that they take 2 capsules and they see that it works. They see that the product actually does what it's supposed to physiologically do. I also love the test strips because when my patients are taking Berkeley Life and they're like, oh, I don't need to take this today, and I don't need to eat a leafy green salad. Instead, I'm going to go out for a burger and fries and a Diet Coke, and I'm, going to do all my bad habits on my cheat day. Their test strip will now show low again. And I find it really great. It's a really great compliance tool for patients to go, oh my gosh, I'm low. Kathy's going to kill me if I don't eat some leafy greens. So,
Yes.
and they have to report back to me. So, yeah, I find it really helpful for people to understand that the cause and effect and how this is
Yes.
working.
Yes, yes, I'd say. Well, as I think back to that day when I met Trish of Berkeley Life, and there was a group of us standing there, and we all tried it at the same time. And we all did the test strip and then took the capsules. And then we stood there visiting for a little bit with the idea that we were going to come back in 60 to 90 minutes, as you said. And I remember standing there going, what is happening with my feet? And they felt tingly. My toes
Yes.
felt tingly.
Yeah.
Moreover, I had another sensation in a different part of my body that was similar. And I turned to one of the other girls that was there and I'm like, feeling anything? And of course, one of our friends was standing next to me. He's a guy. He's like, I think I'm going to go have to find myself a date. We were all
You
being
know?
very polite, but we were feeling the
Uh-huh.
sensation in our bodies.
Yeah, you were feeling blood flow. You were feeling better hormone communication. You were feeling, you're in a community. Oxytocin can signal love and community, even if you're
Sure.
not going to go have sex with that person, right? We could still
Yes.
be attracted and communal and warm together. You're feeling all of that. Body aware people tend to feel it more than others. The other things people tell me, they feel energy. Like they'll come back and say, I was really dragging sitting through this seminar, but now I'm like awake and alert and I feel like I can focus. And I think that's the things I notice the most for myself is I notice increased energy every day. I don't have an afternoon slump. I don't, look for caffeine or other kind of stimulant in the afternoon, but I also feel like it helps me mentally track throughout the day. So I just feel a little more focused, a little more clarity.
Mhm.
And gosh, we all have a lot on our plate. So if I can provide more clarity to my day, then hallelujah.
Absolutely. Absolutely. Very true. I just found that so interesting. I love that you are doing that test strip situation because, we take all these supplements. We're like, are they even working? Am I just,
Right.
but I could actually feel it myself. So I'm very curious to explore it further. I know nitric oxide itself is mentioned in a whole lot of disease and disorders. And what I'm wondering, and you touched on this a little bit with nitric oxide and mental health, is there a component of low nitric oxide with, let's say, neurodegeneration or brain disease?
There is. And in fact, I just ran across a researcher in the UK in the last few months. Her name is Joanna LaRue, and I can share this research with you. She is specifically studying the the quantity and diversity of the oral microbiome that is nitrate reducing in relationship to individuals with signs of dementia and whether or not they have the ApoE4
Yes.
gene risk for
Yes.
Alzheimer's disease. Her
Wow.
work and her team's work is very specific, and I'm just dying to talk to her because I want to
Yeah.
learn more about all the different species that she's finding. But yes, we know that nitric oxide acts upon the nervous system as a retro-neurotransmitter, meaning it sends a signal back
I got to write that
across,
down.
yeah,
Retro
retro neurotransmitter.
neurotransmitter.
That doesn't mean
Please.
it's retro cool. It means it's activating across the synaptic cleft, telling the nerve to secrete more neurotransmitters. So we start to see
Really?
dopamine levels rise, and dopamine being essential for preventing dementia, but also for sort of calming the panic response. And we see that in anxiety and
Yeah.
in depression. We see it playing a role. I mentioned that nitric oxide signals the anti-inflammatory pathway. Part of the way it does that is by reverse signaling the need for acetylcholine. And acetylcholine then along the cholinergic pathway starts
Yeah.
to amplify the response to inflammation, bringing in anti-inflammatory components. When that's happening in the brain, we get less brain fog, better mental clarity, better focus, better learning and memory. And there's a lot of research on dietary nitrates for prevention of cognitive decline. There's a lot of that research happening right now.
Wow. I love that level of research. By the way, can you slow down? Whenever I interview someone smarter than me, I'm taking notes like crazy. Please hold. You're going to have to, to say that again. Okay. Is it expensive to take this?
It is not. It is for the average patient. It is, if they're taking the standard 2 capsule dose, recommended dose a day, it is under $50 a month. And what I find is that when you're opening blood flow, you're improving all these functions across the immune system, the hormone system. I should mention it helps improve metabolism. It's very popular using it in conjunction with weight management protocols and gut healing, things like
Mhm.
that. It improves so much at such a foundational level that we're noticing a lot across the 3,000 plus healthcare practitioners that we work with. It's reducing the need for other supplementation that people had previously relied on. So we start
Okay.
to reduce the symptom burden. I personally, with my patients, spend money on great food, a fun vacation,
Hmm.
and items that really bring them joy rather than adding yet another supplement. So what we find is that it's just from a economy of scale, it's really reducing the need for other things. And so it becomes very affordable. The other question we get with it is, do I need to take this every day for the rest of my life? Well, it depends. I personally plan on taking Berkeley Life every day for the rest of my life because I know that naturally my endothelial tissue, which is the site of endogenous internal NO production, it's declining as we age. It's happening. We know that by age 40, we have about 50% less capacity to make nitric oxide in the body that we had when we were 20. And
That's significant.
it is
Yeah.
significant. And when we think about it, keeping open blood flow, preventing platelet aggregation, preventing plaquing in the vessels. It becomes very preventive nutrition at that point. We also know that those endothelial tissues are really susceptible to oxidative stress. Who doesn't have oxidative stress in this world today? We have mental and emotional stress. We're not all eating a perfect diet, so we get some oxidative stressors there. Patients who are reliant upon a lot of prescription medications, they will see their oxidative stress levels uh, go up and their endothelial integrity decline. Anybody who's a smoker or a vapor, or secondhand who is subject to those chemical toxicants, they are oxidatively stressful to the endothelial tissue. That natural age-related decline is happening, and it would benefit everybody to take these every day. Now, maybe you don't for the rest of your life need 2 capsules a day. Maybe you improve your exercise. Maybe you practice nostril breathing more than mouth breathing because mouth breathing has become such a habit for people, especially anybody with sinus issues. I know I used to be that person. I had sinus issues related to a mold issue, and I had to really retrain that habit. We know that specifically nostril breathing enhances NO production. So, all the other things that we can do to minimize oxidative stress and eat more nitrate rich diet, maybe we don't need to take the supplement every single day. But in terms of if you want improved energy, nitric oxide has been used in the gym culture for a lot of years for muscle recovery, post exercise, for enhancing stamina and endurance. I live at elevation and I like to exercise. And so, whether I'm riding my bike or taking a hike, I always take a little extra dose before I go out and do those activities because I want that greater blood flow. I want my mitochondria to be working more efficiently for me. And when we talk about circulation, there's 3 things about nitric oxide signaling that improve that. It's one, nitric oxide increases the number and the quality of mitochondria. It helps with mitochondrial regeneration, where 2 older mitochondria are getting funky and faulty. They bind together, they recycle away the unnecessary parts to create one new healthy mitochondria. Nitric oxide is stimulating that. Nitric oxide is also stimulating the angiogenesis, the creation of new blood vessels, and it's stimulating lymphangiogenesis, the joining together and creation of new lymphatic vessels. All of this is contributing to increased circulation. So
Yeah.
I'm in my 50s. I'm going to keep taking it because I feel the difference. And how I know is I get up in the morning and after my busy days, and again, there's not one of us on this planet that doesn't live with some oxidative stress. My test strip is low in the morning. So therefore, I supplement. I bring myself back to the target zone. I can test before and after exercise to see, do I need to boost my stores? Do I need to, increase my chances of a better bike ride? That kind of thing. I'll use the test strips that way to keep me motivated to eat the salad, to practice my breath work, to exercise, but not too much. There's a lot of people over exercising in the name of health, right?
Mm-hmm. Mm-hmm.
And so all those things together keep me motivated to intake dietary nitrates every day, always with food. And for me, always with Berkeley Life every day too.
Fantastic. I love the era that we're in right now where we can really rely, if we wish, on the longevity science. And what you're talking about here is going to be one of those things that makes the difference between can we have a quality experience for the next 30 years or not. And it's a naturally occurring thing that our bodies do, but it declines with age. And I can hear somebody saying, well, my grandfather, my grandmother never had to take these things. Why are we looking at take, here's the thing. In 124 years ago, the average life expectancy of a woman was 52 years old.
I'd be dead.
Yes, exactly. I know I'm about to have my 52nd birthday, so me too. About to go tits up in the rhubarb, apparently. Anyways. So the thing is, if we wait for evolution to change our physiology, it takes thousands of generations to do so. But because we have developed these enormous frontal lobes, and human innovation and ingenuity is an extraordinary thing. It probably is the thing that changes most on this planet, or changes our experience most on this planet, is when we let humans be innovative. We can now look at the science and say, what are the missing elements that maybe grandma didn't have? And that's why she had a heart attack at 73 and died. And how can we replace some of the things that a body that 2 generations ago, 3 generations ago would have only lived this long? How can
Absolutely.
we, it really is, I mean, the term biohacking gets thrown around a lot, but it really is in the purest form of we're using the science to advance the things that take time to evolve. They will not evolve in our lifetimes, but we can use the science and say, how can we make our experience better? And how can we have a more quality experience and maybe not have the things that our families suffered with?
Yeah, that is beautifully expressed. Thank you for sharing it that way, because that just nails it on the head. I in my own family history, I have a history of Parkinson's disease.
Mhm.
I have a history of cardiovascular disease. I have a history of diabetes and metabolic syndrome with some tragic outcomes. But that doesn't define me. That doesn't define who my body is and how my body, I might have that epigenetic trigger sitting out there, but I don't need to turn it on. And I do need to be mindful. My diet's not perfect, even as a nutritionist. And, I enjoy an occasional adult beverage and occasional piece of cake or whatever it is, right? That is, on the cheat list, whatever. But I don't have to buy into that idea that I am my ancestors and that I will succumb to the same things they do. But what I do owe myself is to take every advantage I can. And in our modern biohacking world, we have so many options, but I like to keep it really foundational and really simple.
Yes. Yes, I agree. Are you navigating the changes of menopause? You're not alone in experiencing shifts like weight gain, sleeplessness, and body changes. As sex hormones such as estrogen change, they can affect appetite and how your body uses energy. It is not surprising then that in addition to other changes, many women notice increased appetite and reduced energy expenditure. Studies have shown women typically gained around 3.3 pounds a year during the perimenopause transition, potentially reaching an average gain of 22 pounds by the time we reach menopause. This is distressing. This includes increases in fat mass, especially around the abdomen, reduction in muscle mass called sarcopenia, exactly the things which contribute to frailty as we age. To help manage this, it has been estimated that women need to reduce their caloric intake by around 200 calories a day during the transition. But stress, feeling hungry, or battling cravings can make that challenging. I would like to introduce Calocurb, a plant-based, all-natural supplement. Calocurb is a patented world-first GLP-1 activating supplement. It contains amerisate, a natural extract from a specific variety of New Zealand bitter hops. Taken an hour before meals, amerisate is released into the small intestine from a patented capsule. It works by stimulating bitter taste receptors in your gut to activate your body's own gut hormones like GLP-1, CCK, and PYY3, the hormones that help you feel fuller, longer, and slow down gastric emptying. Clinically proven, Calocurb has been shown in studies with women undergoing fasting to reduce overall hunger by 30% and overall food cravings by 40%. It has been shown to help reduce calorie intake by 18% on average in studies. Calocurb is designed with no artificial ingredients, sugars, calories, stimulants, or caffeine. Alongside physical activity, strength training, and protein-forward nutrition, Calocurb can help you work towards your goals. Empower yourself during menopause, ladies. Let Calocurb help you stay lean and energized through midlife. Visit calocurb.com and use the code LOVELY10 for 10% off your first order. By the way, are we related? I feel like we have the same family history. We might be.
We might be.
Okay, I want to pick up on something you just said about supplements and efficiency. And this has always been for me as someone who's recommended nutritionally and supplementation for patients as long as I've been practicing, 20 years at this point. How can we get the outcome that we're looking for with the least amount of effort? I love that. I'm a busy lady. I don't want a big complicated dietary plan. I don't want to take 50,000 supplements every day. I mean, I'm pretty sure I'm going to be taking my hormones for the rest of my life until someone tells me not to. I interviewed a guest recently who said, "You're going to pry my estrogen from my cold, dead hands," which I thought was pretty funny. But, anyways, I so resonated with what you said about how when you increase blood flow, which our bodies are meant to do anyways,
Yes,
you are just making everything work better, which means
absolutely.
less stuff to do. Like,
Yes.
yes, more of that.
Yes, and less so it's true. It's going to improve efficacy of all other therapies, whether they are holistic supplement therapies or whether they are prescriptive medications. So our blood pressure study used hypertensive individuals who were on blood pressure medication. When we see blood pressure come down, there's the opportunity to discuss with your physician, I'm naturally bringing my blood pressure down. Could we talk about my dose of my antihypertensive medication and see if that needs adjusting? With hormone replacement therapy, we have several practitioners out in across the world, actually, but especially in North America, using HRT more effectively because they're opening blood flow with nitric
Wow.
oxide support. It's keeping doses low, so now there's less risk of, some of the what we've learned, right, in 20 years since we were all told that hormone replacement therapy is bad and dangerous for you. Turns out not so much, especially when we're using the bioidenticals and the technology has gotten better. But what a blessing to us if we can just open blood flow, keep that dose lower for a longer period of time, improving efficacy, improving safety of it too at that lower dose. And I think there's only a couple cautions I would recommend to people. Anybody going through any oncology treatment, certainly discuss use of nitric oxide support with your oncologist and with your prescribing provider because there are certain therapies that don't benefit from an antioxidant, which is what nitric oxide is, and there are certain therapies that absolutely benefit from it. And another indication would be anybody currently experiencing hypertension and on a medication, nitric oxide can open blood vessels, vasodilate, bring blood pressure down relatively quickly. And so we just want to make sure that individuals don't experience a significant drop in blood pressure. You had a friend there.
Yep.
That's
Drop
the
it.
blood pressure
I was
lowering
gonna say
medication right there.
that's me lowering his elevation from my desk. For the listeners, the
Right.
cat just jumped up on the desk.
Yeah, so we just want individuals in that category to work with their prescribing physician to be safe. But what we see is that people are able to reduce their reliance on prescriptive medications simply by improving blood flow.
Okay, I love this. And actually, that was my next question for you. So we must be related. You just read my mind. Um, is I know there will be a lot of women listening who are already being treated for active cardiovascular disease, because, of course, there is a cardiometabolic thing that happens in the menopause years. And the first line is often just to start with antihypertensives or statin drugs, etc. So there will be
Yes.
women in our age group that are already
Yes.
taking these medications. And so the question I had was, do we have to speak to the doctors about it first, or is it something that's safe to go ahead and start slowly? And you said, with the exception of oncology, and what was the next thing you said?
And anybody already diagnosed as hypertensive and taking a
Okay.
medication for it should discuss with their physician so that dosages of medication can be lowered because you will
Okay.
see a significant reduction in systolic blood pressure within 12 weeks. That's been clinically validated. So we would just use caution there and open that discussion with your physician. And if there's ever somebody's physician who needs more information, send them to Berkeley Life and we will help educate them. We're very much science driven. We very much want healthcare providers to feel confident using our products with their patients. So, but you mentioned, statin drugs. We know that nitric oxide helps prevent platelet aggregation and also cholesterol plaquing in the blood vessels. When we have less inflammation in the blood vessels, we're not going to see as high of inflammatory markers. And our clinical trial showed reductions in homocysteine, in C-reactive protein, in
Okay.
total cholesterol. So you're going to see those medications perhaps work more effectively. And then that opens the conversation with the physician to say, do I need to take this medication for the rest of the life? Because there are side effects, as we know, to some of those
Mhm.
medications.
Mhm.
So I just encourage open dialogue, taking charge of your own health, being inquisitive, and really speaking to physicians. And if your physician isn't speaking to you about it, then perhaps you need to find a different physician who
Oh,
wants to have the conversation.
yes, and we have this discussion on the show quite often, Kathy, about how women are often disregarded by their doctors and how it can be very difficult to find a doctor to begin with, but then to
Yes.
find one that actually is taking good care of you in a way that we are learning ourselves thanks to the internet. We can educate ourselves, we can advocate for ourselves, and these things are really, really important. But I love what you just said about get the open dialogue. Talk to your cardiologist, talk to your GP, and say, this is something I'm trying. And they may not understand, but Berkeley Life has a bunch of one pagers. Are they on the web? They must be on the website. Yes, Kathy?
They are. There are patient dedicated materials, and then there are healthcare practitioner dedicated materials. If you are a patient wanting to have that conversation with a physician, get a hold of us and we can help you with the right materials. Some of them aren't because they're healthcare provider driven, they're hidden behind a wall, but we can get them to you for handing to your physician. And we're happy to help you open that dialogue as well,
Yeah.
too.
Yeah. And I know I just became one of the professionals on the website because I had to upload my license to show that I was legit. So we know that there's good checks and balances in place to make sure you've got your professional portal is the right people in there. Let's put it that way.
Yeah.
And I will make sure you have the link to Berkeley Life and where you can find all of this in the show notes, guys, when you're listening. So just pop over there and you'll be able to click the link. Kathy, you mentioned a few times mold exposure. Now, this
Yes.
is something that I know well myself. I wish I didn't, but I do. And this is in dry ass Alberta, so I can't even imagine people living in the Pacific Northwest or other wet places what this is like. But is there some sort of implication on nitric oxide when you have a mycotoxin exposure or something else?
Absolutely. And I certainly wish I had understood this connection when I was going through my own recovery. Long story short, raised in a water damaged building, teaching nutritional therapy around the country, taught in several sick buildings. And I would watch my students start to cough over the end of a long weekend, realizing that there was mold in our environment. So I went
Oof.
through my own recovery. I went through a sinus surgery. I'm a much healthier, happier person. And had I known about nitric oxide support, then I would have been doing it for a couple reasons. We know it contributes to opening blood vessels, opening blood flow to all the tissues. We know it contributes to waste removal, and that includes metabolites of mycotoxins. We know that nitric oxide is a potent immune system signaler. It attracts chemokines and cytokines to cause an immune response then is mitigated by an anti-inflammatory response. So it could have helped me clean out my system a lot faster had I been using it when amongst all the other things I was doing, binders and things like that, trying to get
Mhm.
these mycotoxins out of my body.
Mhm.
Um, we know that it increases cellular energy, and with that, it's increasing oxygenation, and that it's helping open smooth muscles around the bronchi, so lung expression is better, breathing is better. It probably would have helped me a little bit more in my recovery from sinus surgery, although I had some pretty good tools in place at that time. I was doing ozone therapies and things like
Mhm.
that. But had I known about the impacts on the respiratory system, I would have definitely used that in my mold recovery process. And then just knowing that it's improving the efficacy of everything else I'm using. So whether it's glutathione, NAC, vitamin C, we know that vitamin C and nitric oxide work hand in hand to improve the integrity of the endothelial tissue. That improves your natural capacity to make nitric oxide, opens blood flows, opens air passageways. Yeah, I would have used it every day.
Yes.
Yes.
Wow.
Mhm.
Now, is it like the well, binders you mentioned. So with binders, of course, if anybody's listening and has been through the experience of attempting to bind mold out of the system, oh, you have to tiptoe. You have to tiptoe. And many
Yes.
of us, if anybody who's listening that's had mold and tried to eliminate it or done the work to eliminate it from your body, you can get that Herxmer reaction. So, can you have that with the nitric oxide supplement as well? Do you have to lean into that?
I haven't clinically seen it and I haven't talked to physicians who use it. I suppose, here, let's paint a scenario. We have somebody in a mold recovery situation. Their immune system is on high. There will be elevations in what's known as inducible nitric oxide synthase. The body will be it'll be producing more nitric oxide to fight localized inflammation in the respiratory tract, in the sinus cavities. That person could potentially, when they went to take the salivary test, they could potentially test high. If they tested high, because in a moment in time where their body's at in the immune response, they could be have an elevated NO expression. When I would say let's back off dietary nitrate supplementation would be if they tested high several times a day, every day over the course of a week or so. I happen to work with a lot of autoimmune challenged patients. And so we might expect their inducible nitric oxide synthase to be hyperactivated. But what is also in the literature, and I've sort of confirmed this through my autoimmune circles, including with Dr. Terry Walls, is that by supporting the dietary nitrate pathway, you're actually attenuating or reducing the impact of that hyper inflammatory response, whether it's from mold, whether it's from a food sensitivity, whether it's from an autoimmune flare up, and it helps regulate it and bring it back into balance. So I don't see people really needing to back off the dietary nitrate support. I clinically it hasn't happened for me to see that yet, but I'll keep you posted if I do see
Okay.
it. So I suppose anything's possible.
Yes, yeah. Well, and you know how it is. It's that clinical experience. You'll see it. If someone's going to have the reaction, you'll see it because for those of us that have the mycotoxin, we so sensitive to anybody stirring around those things at all. So,
Yeah.
you
Are you
know,
like me and you walk in, like if I travel and I walk into an old church or a museum, I walk in and now I'm a canary in the coal mine. I go, nope, I can't be
yep,
here.
I'm out. I'm
No.
out. Yep. And if I don't notice it with my nose or my spidey sense, then what will happen is I'll start to cough. And then I'll
Hmm.
be which was the first sign I had gotten an exposure was a cough. So
That's what I get. My lungs tickle.
yes,
It's
again, we must be
interesting. Yeah.
related. Similar genetics. All right, Kathy, honestly, I think I need a nap after this conversation because I need to let all of this percolate in my brainium. Maybe I need to have a Berkeley Life supplement right now.
I think that if you have this test strips on hand, give yourself a test, do the before and after
Yes,
so you can recognize. Let me just make one more comment about that because
please.
there are individuals who say they test low or almost non-existent on the test strip. They supplement, 90 minutes later, nothing changes. What we suspect there is that their oral microbiome lacks the diversity and the quantity necessary of those nitrate reducing bacterial species. So for that, we recommend Berkeley Life has a functional gum. It's a chewing
Yes.
gum. It is dietary nitrates that act as prebiotic food for those nitrate reducing oral microbes. It's got a few specific polyols in it that are known to decrease acid producing bacteria that cause cavities and gingivitis and things like that, and upregulate the diversity of the nitrates. And usually we recommend people chew the gum twice a day 5 minutes each in between meals. And usually within about a week to 2 weeks, we start to see them better converting on the test strip, which is a sign they have started to reactivate and balance that oral microbiome. That also requires some attention to oral hygiene. So removing antiseptic bacteria or antibacterial and antiseptic mouthwashes and toothpaste, and working on their mouth breathing habit to restore nostril breathing, things like that that can disturb the balance of the microbes. We work with a lot of dentists and hygienists and myofunctional therapists and other airway passage specialists on this microbial piece, but it's really kind of great to see within just a week or two that restoration can happen. Now your body is recycling and those nitrates better, and now you're going to see improved scores on the test strips.
Wow. Oh, that's so interesting. Honestly, I need a nap just to let this all percolate, and then I'm gonna I'm gonna sit down and create a map. Okay, I gotta think about all these things that I can use this for. So, thank you for the masterclass on nitric oxide today.
Oh, absolutely. And if you want to, schedule another time and talk about the 48 signs of perimenopause and menopause and how nitric oxide support fits into all that, we can talk everything from
Yes, please.
metabolism, weight management, brain health,
Wow.
dry skin. Nitric oxide promotes wound healing and collagen production. So in a lot of regenerative medicine practices, we see it used. So yeah, we'll talk some
Yes.
more.
I think we have to have another conversation because there's so many different ways that this is supportive for health as we age. And I'm firmly of the belief, and maybe it's because I'm so deep in my perimenopause that I've been talking about it for so long, I'm wondering what's next. I'm starting to create to make the flex in my mentals towards the longevity piece. I'm thinking, how can I do this? Okay, I got through this. This over here was not so fun, but now the best is yet to come. So what am I going to do with this body, this brain, this lifetime,
Absolutely.
however
And I
long it
would
is?
I would like to add the best sex life is yet to come. I think
Woo!
that's a misnomer of menopause is that sex ends and it's all downhill from there. Not true. Not true, people. We can keep our active sex life vibrant and healthy and fun
I love
and
it.
gratifying by following that longevity path.
Oh, I love it. I love it. Cathy Eason, thank you so much for coming on the show. Where can people find out more about you, please, and Berkeley Life?
Yeah, they can find out more about Berkeley Life on our website at berkeleylife.com. We're on Instagram and TikTok, and we have some fun, creative ways to introduce you to this education there. You can always reach out to me, Cathy Eason at Berkeley Life. Just send a note to info@berkeleylife.com and it'll get to me and I'll get back to you. And we want to offer all your listeners today, if they sign up to try Nitric Oxide Foundation for themselves, we'll give them 20% off if they use your discount code, which is lovely.
Of course it is. I love it. Well, I have a question. Thank you so much for that. And
Thank you.
as somebody who has experienced the tingle from the nitric oxide supplement, people, give it a try. I'm amazed at how simple something can be that creates such a change. So, thank you for sharing all the biochemistry of that, how that's actually happening, and making it in a way that's really interesting and entertaining for my people. So, Kathy, I have a final question I ask all the guests on the show, and
Okay.
I'd like to ask you now if I can.
Sure.
Okay, the question goes like this: knowing what you know now, what would you tell your younger self?
Wow, that is such a great question. Knowing what I know now, I would tell my younger self that you'll never know it all. Find as many unique perspectives from others from your own, because that is how you grow and develop. And to take every opportunity your way, and especially the challenging ones, because they bring the most gratification. You learn the most and you gain the most clarity by being challenged. So take every challenging opportunity.
I love it. I love it. That's great advice. Cathy Eason, thank you for joining me on the show today.
Thank you, Dr. Lovely.
The information and other content provided in this show, or in any linked materials, is not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. We are doctors, but we aren't your doctor. Seek your doctor's opinion. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard professional medical advice or delay in seeking it because of something that you have heard in this podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this page and in this show have no relation to those of any academic, hospital, health practice, or other institution. Thank you.